deliberate targeting of healthcare facilities in Gaza. As midwives, we care for people during pregnancy, catch their babies, and offer 6 weeks of postpartum care. We get up close and personal with people during this time, and we are intimately aware of how vulnerable it is, and how community and care and safety are non-negotiable. But the pregnant people in Gaza get none of that. While we emphasize rest after birth, Palestinian women are fleeing bombs mere hours after they have their baby. There are currently 50,000 pregnant women in Gaza and approximately 180 babies born every day. The bombardment, destruction, and lack of water, electricity, and fuel has led to the collapse of healthcare facilities in Gaza and creating a significant obstetric and neonatal crisis. Dr. Ghassan Abu Sittah, a physician working at Al-Shifa Hospital, said, and I quote, "This war is different than the other wars. The destruction of the health system has been the main thrust of the military strategy. Women who are trying to reach hospitals are unable to, due to the rubble and destruction. If they call an ambulance, it may or may not arrive, and people are forced to labor and birth in unsafe and unsanitary conditions without healthcare professionals or equipment." Recently, there was an initiative aimed at trying to virtually connect healthcare providers from Canada with women in Gaza who find themselves birthing alone to help facilitate some level of care, with the idea that something is better than nothing. Unfortunately, this initiative is currently on hold due to the severe communication breakdown in Gaza and our inability to establish proper channels of communication. I cannot express the heartbreak I felt when this initiative was put on pause, and now these pregnant women are giving birth completely and utterly alone.
There have been terrifying reports of women having cesarean sections without anesthesia, which has horrified healthcare and community members across the globe. To perform a cesarean section, let me tell you what that looks like. You need to cut across 7 layers to reach and extract the baby. When women are screaming and shouting in agonizing pain and torture, doctors have to work and cut faster to get the baby out, to decrease the length of the procedure. Imagine listening to their screams and begging for all of it to stop, but you have to keep cutting. The horror of performing surgery on someone without anesthetic will be ingrained into the minds of our healthcare colleagues forever. You also know that speed and lack of lighting, at times needing to use a phone light, increase the risk of medical errors, bleeding, and injury to vital organs such as the bladder. Without water, you cannot scrub or sterilize adequately before a procedure, thereby increasing the risk of infection. So many pharmacies have been bombed, and those that remain have bare shelves. Patients will die from infections that could have been treated with antibiotics that we have access to every day.
We're seeing reports